one point or another, everybody is going to have to deal with a sore lower back, and it's normally going to be precipitated by a pinched sciatica. Oh, my sciatica is acting up. No, it's the fact that you're 50, 60, 75 pounds overweight and your fat ass is pressing and putting undue stress on your lumbar spine, therefore creating a pinch point for your sciatic nerve. Okay, that's the long and short of it. But what can an average person do? Okay, you have the problem. Okay, you can't just immediately lop off your spare tire. Okay, what can you do to prevent this from happening? Because yes, you can avoid lower back problems. Okay, but we all just can't live in bubble wrap now, can we? Okay, because you know what? Hey, your boy over here does have some back problems from time to time. But you know what? That's from overuse. Okay, and go out there and run and not lifting properly, you end up pulling something in your back and it sucks, okay? Have I had sciatic pain? No. Am I trying to avoid sciatic pain? Yes, because the history in my family of back pain is tremendous, and I'm doing everything that I can to try to avoid my laundry list of problems when it comes to hereditary health problems, and this is just one that I can actively try to avoid. You know, cancer, heart disease is eventually going to come down the pike, so I just try to forestall all of this as much as possible. We are a sedentary society. Speak for yourself, especially as we age. The older we get, the more crappy television you just sit around and watch. Our bodies may ache, our legs may be unsteady, our energy is less, and we don't exercise as often. Wow, that just sounds like a you problem, buddy. The pandemic even exacerbated this trend by having us stay isolated, mostly indoors, watching television. Again, that's a you problem. I haven't missed a single day, knock on wood, okay, whether it's through injury, bad busted shoes, crappy, awful weather. I'm looking outside at a horrific rainstorm right now. I would still be outside running if this was first thing in the morning. I don't care. I've been outside 50 above, 50 below. You can't stop me. I've been outside with billowing smoke from lingering forest fires, okay? Nothing's gonna stop me, and it shouldn't stop you either. Those are just excuses. Don't be lazy. Be a doer. Anywho, according to the American Chiropractic Association, back pain is the third most common reason people visit their healthcare provider. What's the first one? They feel bad, or it's their vagina hurts. Okay. And the Cleveland Clinic. Oh, there they are again. I think we talked about them earlier in the week. The name is familiar. Cleveland doesn't get enough love. Kind of justifiably so. Reports that 40% of people in the United States experience sciatic pain sometime during their lifetime. So what is sciatica? Because it just kind of sounds kind of extraterrestrial, really, if you have no idea what it's about. If you suffer from sciatica, you know how incapacitating it can be. Yes, it's not a lie, like shooting pain down your left leg, okay? Because it's a pinch of a very important nerve in your leg, and where it goes through your spinal column and through your hips and all that stuff. Anyways, if you haven't experienced this, read on and you may learn how to avoid developing this common condition. Sciatica arises when a part of the sciatic nerve is pinched, inflamed, or compressed. This nerve comprises the L4 through S2, okay? There are several different portions to your spine. Okay, there's the cervical spine. I completely forgot what that was. And then you got your thoracic spine, which is the longest part. Okay, and then you got your lumbar spine, which is, just above your hips, and then it goes and then it just leads right into the coccyx part. Okay, most of those fuse together during your final growth spurts. That's your your tailbone that's down there. Okay, just remnants of when humans had tails, when we all used to be monkeys, okay, if you think that we all just got here because God just decided to snap us all in creation. Okay, whatever. You probably also believe that the earth is 500 years old and Jesus partied on the back of a Tyrannosaurus Rex. That's totally up to you. Believe whatever you want, but you probably also see herniated disc, and then you think that we're all going to eventually fall off of the flat earth, but whatever. Anyways, that's what they're referring to here, by the way. L4 is your lumbar spine, and then S is, yes, your sacrum. Okay, that's also comprises your your coccyx, your tailbone that's down there. Okay, and then there's two little discs at the bottom, which are specifically C1 and C2. But anyways, is the It is the thickest, ladies, and longest, hello, nerve in the body. You might feel the discomfort almost anywhere along the nerve pathway, but it more often travels from your low back to your buttocks. The back of your thigh and calf. The pain can vary wildly from mild ache to a sharp burning sensation or excruciating discomfort. Yeah, all depends on the pain tolerance of the person reporting the pain. Anyways, sometimes it can feel like a jolt or an electric shock. It can worsen when you cough or sneeze, or prolonged sitting can aggravate symptoms. Yeah, because imagine that, okay, because your body, naturally, okay, it's an anatomic position, okay? When you're standing upright, when your posture's proper, and you have your palms facing forward like this. I know you can't see it because my framing's a little bit different. You see from my shoulders up mostly. You also see chest as well, so you can't really see the palms, okay? When you have the anatomic position, you have your arms at the side, okay? That is your natural position as your body. That's where everything is functioning as it should, okay? You have everything flowing appropriately. But when you're sitting, obviously, you know what it is to sit, okay? You're compressing, you're lengthening certain muscles that are in the body in an unnatural position that ends up creating pinch points, okay? And that's what happens when things aren't quite as arranged in your body as they should naturally be. There are 4 types of sciatica. The most common is acute, with the recent onset of symptoms lasting 4 to 8 weeks. Chronic sciatica lasts more than 8 weeks and usually doesn't subdue with self-management. Alternating sciatica moves from one side to another, and bilateral sciatica occurs in both legs simultaneously. That sounds awful. So what are the risk factors? What do you need to know? Age, herniated discs, and bone spurs from aging are the most common causes of sciatica. That's why you always hear, oh, my sciatica's acting up. That's it. That's only if Joe Biden can finish his sentence. But anyways, obesity, yes, extra weight creates more pinch points and more opportunities for your discs in your body to just wear away and create, yes, more pinch points. Occupation, jobs that require twisting, lifting heavy loads. Oh my gosh, we're talking about thickness and length and pinching, and now we're talking about heavy loads. Oh my gosh. Driving a vehicle for long hours or sitting in front of a computer might cause sciatica. Sitting, I think you already covered that. Diabetes may affect use of blood sugar, thus increasing your risk of nerve damage. Yes, of course. Arthritis, yes, spine and different mobility problems, obviously. Smoking. Interesting. Like, obviously, smoking's the worst thing you can do, that it has absolutely no benefits. Oh, you look cooler. Cool. I'm sure the morticians agree. Nicotine in tobacco can damage spinal tissue, weaken bones, and speed the wearing down of vertebral discs. Interesting. Diagnosis. At the onset of your pain, get a clinical diagnosis through a thorough history and physical examination are necessary to complete evaluation. Medical practitioners in chiropractic, sports medicine, and physical fitness all know the signs and causes of sciatica. Their experience and training can diagnose your situation and offer options for relief. Yes, exactly. So in the chiropractic field, chiropractic visits have helped me, the author, keep sciatic free for over 15 years. When flare-ups occur, I would go to my chiropractor for stretching, adjustments, heat therapy, and sometimes electronic stimulation. All right. Of the back to help release muscle spasms. And now that I'm healed, I visit chiropractor once a month for maintenance. Physical therapy, yeah, get moving, get up and active, okay? Stretch out, strengthen certain things so that you have any imbalances. Those get corrected, and then proper movement happens as well. Because when you age, okay, things are just naturally going to tighten up. It's the old axiom, if you don't use it, you lose it. It's kind of true, even though it comes from a hack movie that I despise. But anyways, yeah, physical therapy, yoga, daily walking, all of that stuff is great and wonderful. You get active, you start to return your body to its normal proclivities, what it's designed for, okay, what it's supposed to be doing, the better off everything is going to be, let alone just your sciatic nerve, okay, your problems that happen there, okay. Daily swimming, yes, it's exercise with low pressure and a low stress upon the joints. See, most of that checks out. Pain management, yeah, no, exactly. Heat and ice therapy, that makes sense to reduce swelling, okay. You can use some painkillers. I would never recommend them. Never run the risk of opioids or anything like that. But ibuprofen for some, yes, inflammatory relief. Fair enough, I guess. Ergonomic workspace. Yes, stand up and move around every once in a while. Do a posture check every once in a while. Make sure that your shoulders are in line with your hips and that you're properly sitting or standing correctly. Diet. Yeah, no, imagine that, okay? Although most clinicians do not mention the relationship of food to sciatica, yeah, imagine that. One of the biggest risk factors of getting a sciatica problem is being overweight, so why wouldn't diet be brought up? It is wise to evaluate at least what you are eating. Inflammation plays a large part in the irritation of the sciatic nerve. Yeah, exactly. Focus on a healthy mixture of mainly plant-based foods. Yeah, not quite. Bread is fairly plant-based, and I wouldn't recommend that. Diets rich in magnesium promote sciatic nerve regeneration and reduce inflammation. Now, foods high in magnesium include dark leafy greens. We just recently did a big video on magnesium within the past couple of weeks. Baby spinach, collard greens, kale, Swiss chard, dark chocolate, I suppose, in moderation, as long as it's not sweetened with anything that can be additionally inflammatory. Dried pumpkin seeds, black beans. Ugh, beans are terrible. Avocado, dried figs with an I. Yogurt. Bananas, dairy, and apricots. Again, we've broken that stuff down a little bit. You know, be careful with your dairy selections. Bananas are worthless. Dried foods are interesting, and legumes are just big carbohydrate dumps. Anyways, in addition, nutritionist Akasha Mishra in Salamala recommends adding green tea. Yes, turmeric, ginger, omega-3 fatty acids from oily fish, walnuts, olive oil. Yes, you're obtaining your regular good healthy fatty acids and all that good stuff as well. So yeah, all of that checks out. Getting your B vitamins as well. Choose salmon, eggs, and mushrooms as your best source. Avoid saturated fats that increase inflammation. Yes, your omega-6s that are out there include foods. This category includes high-fat dairy products. Ones that have been through certain processing that's out there, the ones that are just have a whole bunch of extras added to them. Okay, fatty red meats, more or less just kind of grain-fed meats that are out there, and yeah, that's more important. And processed or fast foods. Yeah, no, that's pretty much the same thing. Hydrogenated oils, fried foods, white bread, pasta, chips, crackers, and snacks. All of the regular jam. So preventing sciatica. Walk daily if possible. It should always be possible, okay? I don't think everybody lives in cages. Follow a regular exercise regimen to keep your back strong. Avoid activities that irritate your back, especially prolonged sitting and standing. Maintain proper posture. Use good body mechanics, especially when lifting, turning, and bending. Lose weight if you need to. Yes, of course, always be pursuing better health for yourself. Not better health, that's a scam, but just overall personal better health. Eat a well-balanced diet full of whole, fresh foods that support good health and a strong back. Because, again, I want everybody who watches this video to succeed. And back pain is something that's going to hit you when you least expect it. It doesn't matter how healthy you are. It will rear its ugly head and it could slow you down. Or you could take the preventative steps to just make it a temporary bump in the road instead of just a full-on block. So with all of that said, thank you all very much for the gift of your time. I've been Don Consuelo. Once you follow your gut and get after it. Take care, everyone.